Have you ever feel pressure or pain in your ear? Hi, my name is Daria. I'm an ENT doctor, and today I'm going to explain the most essential things about ear anatomy that can directly affect your diving. You will learn why you sometimes feel dizziness underwater, who are more prone to eardrum perforation, and why do some people don't need to equalize at all. Let's make it quick, simple, and useful. Our ear has three parts: outer ear, middle ear, and inner ear. If we talk about outer ear or external ear, it's a part before your eardrum, and divers face two common problems here. And the first problem, because our ear canal is covered with skin, if the water after diving gets trapped inside or you scratched your skin, it can become inflamed, and that is the famous swimmer's ear. Here is a separate video about swimmer's ear and about prevention tips that are really important. The second problem is earwax blockage. The glands in your ear canal produce wax, which is normal, but too much of it can swell when you dive, blocking the ear canal and causing a feeling of fullness and pressure. This can make it hard to tell whether you actually equalized or not. So if you're prone to this problem, better visit a doctor before your free diving trip so you won't be confused underwater. At the end of the outer ear lies your eardrum. Tiny membrane, just a bit thicker than your hair. It's a window to your middle ear and it moves beautifully when you equalize. Let's recheck. But if you have frequent ear infection when you was a kid, scarring or previous perforation, be extremely gentle when you're equalizing and better postpone your dive if you have difficulties with it, because even a small increased pressure can risk another tear. If we continue, behind the eardrum is the air-filled space, middle ear, and it contains bones, muscles, ligaments, but the most important for divers is pressure equalization. Your middle ear connecting with outside world through eustachian tube that normally stay closed and isolate your middle ear. When you descend, the pressure outside increase and you need to equalize it with your middle ear because this cavity is closed, and you push the air actively through your eustachian tube to your middle ear, and that is equalization. So what will happen if you descend but you're not equalizing your ear? The pressure will be equalized but in painful way with blood vessels rupture or eardrum perforation. That's what we call barotrauma. And now I have interesting question for you. Have you ever met people who never need to equalize at all? If you ever meet them, please leave a comment. It's really interesting. So how it could be possible? Yes, it's quite possible if your middle ear is permanently open due to eardrum perforation or eustachian tube dysfunction, when your eustachian tube stay open all the time. So how anatomy of your middle ear affects how often you need to equalize. So how often you need to equalize? You probably hear a lot of advices like all the time or every half meter or when you feel pressure, but the answer lies in the size of our middle ear, and it's really individual. Our middle ear is not only here. Behind it there is other space that we call mastoid cells that are 5 till 10 times more larger than your middle ear, and this airspace also need to be equalized. So if your mastoid cells are large, pressure builds up more slowly, so you equalize less often but may need to blow air a bit longer. But if your mastoid cells are small, pressure change faster, so you must equalize more frequently. And now we reach the inner ear, the organ then responsible for balance and hearing. And unlike middle ear, it's filled with fluid, not air, so it doesn't need to be equalized. However, two delicate membranes separate it from the middle ear, and if you equalize too forceful or fail to equalize at all, these membranes can rupture, leading to dizziness, ringing in the ear, or even hearing loss. And also this organ is very sensitive for pressure difference, and if you equalize only one ear but other not, this pressure imbalance between ears can cause vertigo underwater. So here was a quick guide to your ear anatomy, and if you still have any question, please leave a comment. I will be happy to answer. Thank you for watching, and if you want to learn free diving from medical point of view, don't forget to subscribe.